Want to welcome everybody to this WHF Heart Cafe conversation. My name's Larry Sperling. I'm a preventive cardiologist. I'm the founder of the Center for Heart Disease Prevention at Emory University School of Medicine in Atlanta in the US. And I have with me one expert, and we will have a second expert shortly to discuss a really important connection. We're here to talk about deepening our understanding of the heart-brain connection to advance optimal health. Now, it doesn't get more important than the heart and soul. And we more and more have recognized this interconnectedness on many different levels, really a cellular level, a signaling level, biologic, but the heart and the soul are very connected on many levels, and we'll be having this discussion as we better understand not only raising awareness of this connection, but what we may be able to do about this connection as clinicians or on the level of public health, and importantly, to affect and improve heart health and brain health across the world. So I'm going to introduce one of our experts, and hopefully Dr. Mehta will join us shortly, but we're very fortunate to have Dr. Adrian Noriega de Colina with us today from McGill University. And Dr. La Colina is a distinguished healthcare professional. He's an advocate for interdisciplinary research and interdisciplinary thinking. And in particular, he's been a global leader as a champion in this heart-brain connection. And so we look forward to him here today being an expert, but also helping us to think about this holistic approach. We are often unintentionally creating silos, silos in terms of our understanding of anatomy and physiology, silos of expertise in medicine, silos in population health, public health, and often global health. And so how do we begin to break down those silos, thinking about the populations we serve by improving what is an aging population at greater risk of the disease states that are affecting the cardiovascular and neurologic systems. As far as our time together here, we're going to have a little bit of a Q&A. Dr. Mehta, I'm saving a hot seat for right here next to me, and when she comes, we'll include her in the conversation. But importantly, we want all of you out there in the audience to be not only listeners, but participants. And so we're going to have a conversation, get that conversation started, but we want to include each and every one of you in the conversation. So be thinking about some of the comments you'd like to contribute, some of the questions you have, and together, let's try to figure out how to not only advance this heart-brain connection, but advance the heart-brain connection as we go back to our day jobs next week across the world. So we're going to start off, just tell us a little bit about some of the exciting work you do and how it's related to this heart-brain connection.
Absolutely. And we're talking about the connection between the brain and the heart to, in my opinion, one of the most important organs. So this connection is essential for our overall well-being, and we try to disconnect it. We are in a cardiology conference. I'm going tomorrow to one of the major Alzheimer's research, which is very much centered in brain health. And they seem to be very disconnected one from the other. But when we see those patients, either a patient with a post-myocardial infarction or we see a patient with mild cognitive impairment, we see an individual that's actually might be having both conditions, might be at risk of both conditions. So we have to think of it in a more holistic way. In part of the different hats that I wear, I'm the clinical lead in a precision medicine company called Perceive AI, where we have developed models to forecast how both our brain and our heart health progress over time. So for example, one of the things that we do is we integrate multimodal data to forecast how a patient is going to evolve over the course of their patient journey. So we try to identify multimodal factors from the very first patient visit. And that allows us to take, for example, anywhere from demographics to a simple cognitive test, a blood draw of different things that we see in primary care, and eventually when we get to that stage, imaging. Integrating that kind of multimodal data allows us to get a prognosis of where that patient is going to be in a specific period of time. The original concept, or we started working on this, was back when we were many years ago doing our PhD work. We were trying to see why many of the clinical trials were failing. And the reason why a lot of these clinical trials, specifically in neurology, were failing is that we were not able to predict the eligibility of those patients. Based on the eligibility of those patients, we were not able to predict where a patient was going to go during the course of the study. So we were taking a very educated guess based on a simple cognitive exam or a blood draw or a blood analysis, but that didn't tell us where that patient was going to go in the future. That told us where that patient was now. So basically, we try to see in a very holistic way, from as much as possible for the very early stages, where is an individual patient going to go in a specific period of time. And hopefully, we can be able to predict from that very first visit. We see that patient in a cardiology setting. We see that patient in a neurology setting. Where is that patient going to go during the course of our interaction with them and during the course of their treatment?
So predictive analytics, thinking about things on a big data level to help better understand our individual patients. Let's dig back to some of the basic mechanisms. And our blood vessels, our microvascular, our macrovasculature, really is the largest organ system in our body.
It is.
I'm a cardiologist, but very aware of the interconnectedness of risk for my patients. And even when we talk about Alzheimer's type dementia, many dementia cases have mixed etiologies.
Absolutely.
With a vascular component. So mechanistically, from a science level and research level, I mean, why do we even have this connection? Of course, in the human body, the brain, the neurologic system, and the heart, and let's include the endocrine system. Really, our interconnectedness on a signaling level, is not separate. So how do we think about the mechanisms of this connection to better understand opportunities to address it?
Absolutely, and we have to see it from different angles. One of them, for example, is part of the work that we have explored is arterial stiffness. That is the stiffness of your arteries as you age, and as we all age, our arteries become more stiff. That stiffness reduces the flexibility of those large arteries, for example, and that translates not only into what we know in the cardiology space as the higher cardiovascular and mortality risk associated to that, but there's also the risk associated to your brain. So as arteries become more stiff as we age, that stiffness translates the pulsatile pressure into our brains, and that exposes us to several conditions, one of which is cerebral small vessel disease, for example. So, and this is part of what you were mentioning related to a vascular dementia or mixed etiology dementia, where the accumulation of that damage through the cerebral small vessel through the increased pulsatile pressure is becoming a risk. So what we did, the work that we did was trying to identify how can we in the clinic determine a proper threshold for stiffness. What's a normal level of stiffness? The guidelines at the time were talking about a specific threshold around 12, which was more related to the heart. But the heart had the mechanisms to, let's say, keep with that burden of 12. That's meters per second, which is the way that we quantify it. And that's the speed at which the blood goes from the femoral artery to the carotid artery. That's 12 meters per second. But your brain actually is at risk at a much lower level. What we identified was 8.5, for example. So that meant that your heart might be okay at a certain level, but your brain is already suffering. And you're accumulating the damage over time. And as time progresses, you're already accumulated the level of burden to the white matter in your brain. And eventually that translates into mixed pathology dementia. So the way that we have to think about it is trying to think how both treatments, treating both interactions might be affecting or might be damaging your patient's therapy as you progress.
Fantastic. So, that's I'm going to say a research tool to measure arterial stiffness, although now coming out into the, clinical domain in some ways. As a cardiologist, as a preventive cardiologist, I often use just the simple measure, we call it the pulse pressure, as people age, the differential between their systolic and diastolic. And then let's take a step back. You're talking about the impact over time of these stiff vessels in the brain, in the aorta, in the heart and vasculature. Often there's questions out there about not only addressing blood pressure that can be too high, can the blood pressure be too low? Is there a sweet spot for longitudinal health?
Absolutely, and as you can know, there's hypotension. Of course, we always concentrate ourselves in hypertension because actually that's still the most important modifiable risk factors, but there's hypotension. And the same probably can go for stiffness. You need there's a certain sweet spot, as you were saying, at which we want to intervene. And that's true for also the treatments that we can provide. For example, there is a sweet spot at which we can offer preventive therapies. And those can be effective up to a point, but not only for arterial stiffness, not also for hypertension. At some point, you have to bring additional tools, which is pharmacological treatment. And you have to add that to your therapy, but there's going to be an inflection point to which preventive interventions can actually be efficient, after which that inflection point, then you're going to have to use some kind of combination. And I think we see that across a number of conditions. And just finding what's the adequate point of that inflection point is very important, and not only for the populational level, but also for the person, for an individual patient. How do we take that populational level approach into a more individual patient approach, and what's the inflection point for you as an individual, for me as an individual, which might be a little bit different.
Yes. Well, thank you for that. So pharmacological approaches, we certainly are understanding the basic science better. We must also appreciate the impact of upstream factors and population health. Hypertension, in terms of population attributable risk, has the greatest impact on our heart and our soul. And so just awareness of that and some of the public health things we can do, not on an individual level or even a health system level, in terms of sodium reduction, creating healthy places for people to be more active, and working on improving physical sedentariness, that ratio. So I'm going to come back to you in a minute, but we are very, very fortunate to have our other expert here to help discuss this heart-brain connection. I'll introduce Dr. Lakshmi Mehta, who's a nationally recognized leader in preventive cardiology and women's cardiovascular health and the complex interplay between the heart and the brain. I've gotten to know Dr. Mehta over many years now, and so, she's a leader on so many levels, of course, clinical care, but a champion in wellness. And as we think about this heart-brain connection, we can think about it on a cellular level, a vascular level, an anatomic level, but we also must think about this on a human level, and we often underappreciate. I think back to the InterHeart study, and one of the most powerful findings of InterHeart that looked at why people have heart attacks all around the world, case controlled, was that having stress, anxiety, or depression is as powerful as a risk factor as having diabetes, and we often, don't appreciate that. So Dr. Mehta, so great to have you here with us today. And let's just start off, in the different worlds in which you're a leader, tell us about this interaction between the cardiovascular and neurologic systems influencing our health and patient outcomes.
Yeah, thank you for inviting me to speak. There's so much overlap, right? Like if you think about it, all of the cardiovascular risk factors for the heart also impact the brain. But mental health and anxiety, we often overlook, and that actually plays such a big role for our patients. And I think the biggest thing about that interplay of the mental health is the fact that when our patients are struggling with mental health conditions, what are they not going to do? And they're not going to do everything that they need to do, and that may be the lifestyle stuff, so eating properly or not eating at all, not exercising, not getting the adequate sleep that we recommend, and then not taking the medications that are necessary for their cardiovascular brain health. And so that interplay is so strong. And we're talking about that for patients, but may I take a step back though? Most of us here is some sort of healthcare professional. And so my other area of passion is well-being for us as professionals. And I would say that we're all at risk. We all lead very high stress levels, and our data shows that at least 50% of us are struggling on a high stress level, or 27% of are burned out. So we're not even doing the things to take care of ourselves. So how can we even take care of our patients when we're struggling with all of those things and we're hiding with mental health conditions too, right?
Yeah, so thank you for bringing that up. It's very real and very important, because as we should look at ourselves as caregivers, we're the ultimate caregivers, because each and every day in our professional lives, we are charged with the care of many others. So we touched upon hypertension.
Yes.
And some of the mechanisms of hypertension. I raised the question about, could the blood pressure be too low in addition to too high, and how do we think about that population attributable risk related to high blood pressure, but very powerful risk related to cholesterol abnormalities and this heart-brain connection and risk for dementia. So how do we think about cholesterol as central to the risk for dementia? And I'll tell you, I'm a clinician as well, and so frequently I get asked the question about dementia, because many people are, of course, more afraid of dementia than a heart attack, more afraid of a stroke than a heart attack. So how do we convey this link? But also, I frequently get asked, can my cholesterol be too low? And does this put me at risk for dementia? Because when we start talking about pharmacotherapies, there's likely some significant misinformation about there that medical therapy to treat your cholesterol can promote dementia as opposed to prevent cardiovascular concerns and brain concerns and promoting health. So I gave you a mouthful in there, but cholesterol, and how do we make this connection, and how do we convey the importance of that in heart and brain health?
That's really challenging, because how do we dispel the myths that people have heard is really hard. But we know that having a high LDL can lead to increased atherosclerosis, not just in the heart, but in the vasculature of the brain as well, and carotids. And we know there's increased inflammation, and so the atherosclerotic process is elevated for the vasculature, causing vascular dementia. There's association with Alzheimer's disease as well with that. And then we know, like, HDL, having a high HDL is actually beneficial and promotes clearance of some of the beta amyloids that are also associated with Alzheimer's disease. So having high HDL and low and LDL is going to be imperative for our patients. And we've got great pharmacologic agents, and even more in recent years than just the statins. But the dispelling for our patients is challenging because they're hearing about the potential side effect of memory loss with statins. And I have in my 20 plus years of practicing as a cardiologist, I've only had a handful that truly had a memory issue related with their statin. It's real for those handful of people, and you can pick it up yourselves or their family members can, and sometimes it's one versus the other. So I try and counsel them that there's actually more proven benefit of not only cardiac, but also of the Alzheimer's and other things. And that can help for most, unless they're completely into alternative medicine. If they're not willing to take the medications just yet, at least getting them to do all the necessary lifestyle things is going to be imperative. I don't know, Larry, like in your practice, they may say no to statins, but yes to red yeast rice. Like, I don't know if you've seen that.
Of course. Frequently, we need to be good listeners and meeting people where they are in all levels of what we're trying to accomplish, whether it's with individual care, precision medicine, trying to focus on populations. It's all about relationships and trust and building that trust. But we're not helping an individual if we are trying to promote therapies that they're initially not comfortable with, and building that, that relationship is key and important. So what I'm going to do is I want to be sure we engage and involve our audience. I'm going to go back to Dr. De La Colina with a question, but let's try to I'm going to keep my questions short. We'll keep the answers pretty short because I want to be sure we have time for all of us to extend our conversation here. So this is an exciting time related to this heart-brain connection. Where do you see this going? And this is an area that you focus on in a lot of the work you do. What's happening in the next year or 5 years, let alone projecting into the future in terms of science and research?
Absolutely. So one of the most exciting fields I think is the advance of wearable devices. So when I was doing my PhD, I remember we used to have this massive, the old blood pressure cuffs, and now we have wearable devices that allow us to track a lot of those risk factors in a more continuous way, like continuous blood pressure monitoring. We have continuous glucose monitoring. So there's a lot of new data that's coming on. I think it's very exciting. If we combine that with the advent of all of the omics space, I think we're understanding a lot of what we like to call a longitudinal phenotyping of those patients. So I think that's a very exciting space. And to your point, Larry, on why are we more afraid of the dementia part than the heart side of things, is we don't have a lot of treatment for dementia. So hardly any, but we can survive a myocardial infarction, and we still can make it to the other side. So I think that's what most of the patients still are afraid of.
Do you think the rising levels of dementia, is this an aging phenomenon, or is this a gene environment behavior interaction in that globally human beings are just becoming at greater risk for earlier dementia? Or do you think it's human beings are encountering cardiovascular and brain risk at an earlier stage in life? And I don't, there's no definite answer, but any thoughts about that?
Yeah, there's no definite answer, but also I think both things could be true at the same time. We have seen an increased rise of what we call early onset Alzheimer's disease and early onset dementia. So that's younger cases in their 50s. That has exploded, and that could be tied more not only to the genetic part, so this kind of epigenetic phenomenon associated to the way that we live, but also the pollutant, for example. There was a very big study in the Lancet Neurology a couple of days ago talking about the influence of pollution, for example. But also, we're much more as a species in numbers, and also we live much older, so the prevalence is also going to skyrocket.
Yeah, so we're here at the Heart Cafe, the World Heart Federation, talking about the heart-brain connection. We have a brain expert and a heart expert sharing their expertise and wisdom. I'm going to ask both of you and then flip it back to Dr. Mehta for a few questions before we open this up for conversation and comments and questions from our audience. But how do we do better? We talked about the interconnectedness of the heart and the brain and the cardiovascular system, the neurologic system. How do we do better integrating this approach as opposed to our typical disconnects that will propagate where we continue to be? So how do we get more interconnected? Maybe a brief answer, and then for Dr. Mehta, a brief answer. How do we get more connected? Because we're connected right now. Here we go.
I think we have to start with this kind of conversations, trying to understand what is the kind of patients and profiles that you see and what's the kind of patients and profiles that we see. But then we need a solution that integrates within the system. If it doesn't work within the system that we operate in our current workflows, we're never going to get out of those silos. Mm-hmm. So, and I think a good approach is funneling a lot of that through primary care. Primary care is kind of the center where a lot of this is seen, and we usually get the specialty care at a much later phase. If the primary care can be a center, then we can all intertwine surrounding that kind of environment.
That's great. So, Dr. Mehta, how do we get more connected on a systems level, organizational level, and again, coming back to those that we are serving in a trusted fashion?
I mean, I agree with the comments that you had made. And if we think about it, it's not just the heart and brain, it's also cancer, right? Like that a lot of the risk factors and what we're talking about overlaps into the cancer world as well. The problem that we have, at least in the US, is that we're incentivized to see a patient for their individual disease processes, right? So they're going to see me as the cardiologist separately from the neurologist. And I think it's always going to be disconnect when we're not communicating together. And it's going to change with the drive of our patients. Our patients are getting tired of the disconnect, and they're asking for, see me as a whole individual and give me a whole output. And I wonder if with all the technology that you're talking about in the future, it's going to be AI driven of like, what are the solutions for me? Put it all together as one individual. And that's going to be it. But we do have to reverse trends, right? Because the mortality curves, at least in the US, we were doing great, and now we're doing not so great. We're reversing and it's going back into history. So a lot to be done, but I think we need to think of a patient not as an individual disease, but as a whole person.
Well, these are stressful times, very much so, and these are stressful times as healthcare professionals, as for those that are trying to improve heart and brain health across the world. And I mentioned earlier on just the heart-brain connection really comes together at the soul. And I know you're an expert on stress and depression, but thinking about that in a positive way related to well-being and wellness. First, just tell us a little bit about this connection. You know, is it cortisol levels? Is it inflammation? You know, why does having stress, anxiety, and depression increase our risk for heart attacks, strokes, and cardiovascular events, and likely for dementia as well? And then how can we better recognize, but in terms of our roles as promoting health, well-being, how can we be a force for good?
Sure, that's a loaded and long question. So I'll just pick one area though. And so I think like the stress levels, the lack of sleep increases the cortisol levels, and then your stress hormone. So simple example that really connected our worlds a decade plus 2 decades ago was stress-induced cardiomyopathy. That's a like really great example of mental or physical stress and those high cortisol levels, catecholamine levels that are increasing and causing an acute cardiac event. And so that's what I would say. Obviously, there's other like pathophysiologic mechanisms and inflammation that can impact it. But what can we counsel our patients on and ourselves would be that, stress is always going to be part of our lives. Like there's no way that we can't have stress. There's good stress and there's a bad stress, right? And so how do we kind of try and mitigate some of those negative effects and stuff? That's where really counseling our patients and ourselves on exercising. Exercise is a great medication for blood pressure, for cholesterol, for mental health, and then, making sure that we're eating the adequate foods and getting nutritious food is going to be important. I know I'm Indian, so people are going to think that I'm going to say yoga, and I think yoga is great. I don't do yoga, but it's because I have bad wrists. But there is some value in things like yoga, Tai Chi, mindfulness, being in the moment, and sometimes stepping out of the moment and doing the breathing exercises is going to be key for our patients. But sometimes even for myself, when I know that I'm going to go into a room and I know it's going to be a bad encounter, is just trying to breathe out first so I can go in with a fresh mind. And that's what I try and tell the patients is trying to find that. And then sleep is going to be essential. I think we all overlook sleep. And we go to our devices in the middle of the night and things like that. But sleep's going to be essential for the brain needs to rest.
Absolutely.
And no amount of caffeine. I know I hit the Starbucks here all the time, but that's not going to, that really isn't, that's a Band-Aid and a bad Band-Aid.
I think sleep is one of the risk factors that have been overlooked for a long time. And it impacts everything because sleep, for example, there's something which is called in neurology like the lymphatic clearance. And that's where part of the process where we clean or we depurate a lot of the neurotoxins that exist in our brain. There's a lot of research that is being done. It's currently at MIT that they're doing they're trying to understand why this kind of lymphatic clearance, when it's impaired, is very much linked to our future conversion to dementia and Alzheimer's and all of this kind of pathology. So sleep is key.
Yeah.
Yeah.
So Dr. Mehta, Dr. De La Colina, I'm going to ask each of you to give one word that summarizes this heart-brain connection. My word's going to be interconnectedness. Each of you, one word, and then we're going to open up to our audience here for comments and questions for our remaining time. So do you have one word to summarize?
Precision.
Precision, okay.
Yeah.
I'm going to use a hyphenated word, whole person.
Whole person. So interconnectedness, precision, and whole person. And since I'm the chair, I get to say global. So 4 words. So there'll be a roving mic, and please feel free to add some comments to this discussion and dialogue. It's very important. And some questions for our experts as well. And if you can introduce yourself and tell us where you're from.
Yes, my name is Guido Bergman. I'm from Argentina. In terms of, besides the Alzheimer or all the dementia disease, what do you think impact more one or each other? The brain into the heart, or the heart, or the problem to the brain? Just to open the gate to first go into the patient.
That's a little bit like the chicken.
It's going to depend who we're asking here. So let's start with Dr. Mehta. Do we start with the heart or the brain, or if you have to choose one, right? That you're saying yeah, okay.
Well, usually I would say I'm biased towards the heart, but I will say us cardiologists and cardiothoracic surgeons have done a better job because we've created an artificial heart, but we have not created an artificial brain yet. So focus on the brain first.
Funny that you mentioned that because there's actually a project we're involved where we're trying to develop a brain model, but well,
is that called AI?
But I'm also biased a little bit toward the heart because I did a lot of my PhD work on the vascular risk factors. But I do think that although it's a little bit of like the chicken and the egg, but the heart if the heart malfunctions, eventually the consequences, the brain is going to pay the price.
And thank goodness. So sometimes we think this is our artificial brain that we carry with us, but thank goodness we don't quite have the artificial brain yet. Other comments or questions from members of the audience?
Hi, I'm a medical student from Brazil, and I was wondering, we know that depression and anxiety and high levels of stress and burnout are related to several elements of cardiovascular and neurologic disease, but do we know of any mind health, mental health interventions that are non-pharmacological that could have positive effects on these outcomes? Because it seems like we are very good at prescribing antidepressants and all that, but could we do like gratitude interventions or things like that, or meditation? Are those effective?
Yeah, let's start with Dr. Mehta because I know she's dedicated a part of her career to this question.
So you're talking about us as healthcare professionals, not the patient, or are you talking about the patient or both? Both. Okay. Yeah, you're right. Like most of my patients don't want to take an additional medication. And my colleagues, and I'm Chief Wellness Officer for Ohio State Medical Center, so a lot of physicians and nurses, nobody wants to take a medicine for that, for their mental health or burnout, because they have to then maybe report it, and they're worried about credentialing as well. So there are things that can help with well-being. First of all, a lot of people focus on the individual. And there's a lot of external. So I always say, like at my institute, we need to think about fulfillment in our lives. And there's a lot, what is the culture of wellness that's impacting them? So like vacation time and, what's your interaction with your leader or your boss or your spouse if it's a patient or children, right? What is that culture, and are we supportive of each other and creating that psychological safety and other things? And then there's the optimization. So whatever system optimization, I don't like to say efficiency, but how do we improve our work days? Whether if you're a clinician, like to get you to remove the unnecessary administrative things that are burden, like the electronic health record, to actually seeing the patients. Or, if it's your patient that's whatever field or occupation they have, optimizing that is going to be essential for them. So those are the external things. But internally, our overall well-being and health is going to be important in wellness. And so that's going to be, like we talked about, the diet and the exercise are going to be absolutely essential. So having social networks is critical for mental health. And that's one thing that we have really promoted here at ACC, both here for our US, but also for our international members, that we provide connection in this environment and like in the virtual environment. Because if you have connections, you feel that social connectiveness, that can help with mental well-being. You can learn from each other, but also you're not alone in the struggles. There's the gratitude, like you had mentioned, is important. So sometimes I like to say, like, at the end of the day, think of three things that you're grateful for. And I mean, the three of us could say today, one of the greatest things was grateful things is the opportunity to share our knowledge with you all. It could be something simple like that, but just so powerful as well. Or it could be I opened a door for someone who was not assuming that. So simple things, because gratitude gives happiness, internal happiness as well. Mindfulness, yoga, but I don't like to only focus on the individual, because usually the stress is going to be an external that's impacting us. We have to learn how to adapt to it, and that's going to be critical, but we also have to fix our environment.
So I think we have time for one more comment or one more question. If there is a comment or question, if you can keep it brief, and we'll also try to keep the answer brief, and then we'll move to some concluding comments, and then we'll finish up this session.
Hi. I'm Stephanie, pharmacist from Hawaii.
I think, yeah, I can't hear it, so
Oh, sorry. Is this better?
Yes.
there you
Hi.
go.
Okay, so I was just wondering what your thoughts were about maybe integrating more importance of spirituality over secularism, because I feel like, you can sort of tell people to do these things, but I think it probably helps to sort of, because we're such an individualistic society, might help to, like you said, interconnectedness, feel as if we're part of a greater whole, that we're part of the fabric of life. And those things aren't really focused in like a secular context that we are sort of swimming in. So
So your question is, can we build in spirituality into the science,
yeah, even
and
like
precision
nature,
medicine?
nature
and,
could be like something to draw you outside of yourself and like see the interconnectedness and like the awe, kind of bringing awe into it as well.
So is there biologic benefit of awe and spirituality?
Yes, I think, in Western society, we are too, like the fulcrum is too much on secularism and too little on spirituality, but we are sort of, as humans, understanding how the software is formed. Like, we're communal, we are also spiritual. There's some part of us
Continue
that
to
needs to be
maintain our
fed.
humanness.
Yes, the humanity.
Yeah. So somebody want to handle that one?
Briefly,
Maybe just, yeah.
briefly I think from the science, there's evidence that supports, for example, meditation as, you were talking about spirituality, but that's one form of spirituality, and meditation has had an impact in actually reducing all of the risk factors, for example, that she was mentioning in the previous question, right? Anxiety, depression. It plays a role, and there's interventions that there's science to back that up. And also, spirituality as a person's belief associated to their, for example, cognitive performance in the future and conversion to dementia. There's some evidence that points to the direction that people who are a bit more spiritual, a bit more involved in those kind of activities, might be the social aspect of it, right? They're going to church, or going to a special kind of religious event, and that social aspect plays a role. Or is they're being spiritual? We don't know. But definitely there's a role interplay, and studies have already demonstrated some direction into this.
Well, great. Well, first of all, this has been a great Heart Cafe conversation and session talking about the heart-brain connection. Clearly, we've learned a lot, but we have a lot to learn.
Absolutely.
Do want to thank our experts, Dr. Mehta and Dr. De La Colina, for joining us here as part of this conversation. But talking about interconnectedness, we want to thank each and every one of you for taking some part of your busy time here at ACC 25 to join us in this conversation, and just wishing you a great rest of your meeting. But get out there and be a champion of this connection in those that you serve. So thanks to all for being here today.
Thank you.